Ingrid Owens-Gonzalez. Welcome.
Thank you.
Could you present yourself for people who don't know who you are? Could you tell us a little bit about you and your practice?
Yeah, I'm Ingrid. I've been an SLP, speech language pathologist, since the fall of 2011. I grew up both in the US and in Mexico, so I am a Spanish bilingual speech language pathologist over here in New Mexico. I've been in California and in Texas growing up, but New Mexico is now where I've been the longest as a grown-up. So I've practiced here my whole career. I've been in the schools for 13 years. I actually just left the schools. And then I've also done early intervention. I've done preschool, middle school, and K through 5. So elementary, primary school. And I've done a little bit of adult covering when people are gone. But yeah, I'm mostly pediatric bilingual speech language pathologist. I'm a mom of 2 daughters and 2 dogs. And my husband is why I'm here in the northwest corner of New Mexico. If anybody ever visits Colorado, it's like across the way from me. It's right here.
Nice.
I go to Colorado all the time. So yeah, that's a little bit about me.
I would definitely like to come and visit. I've heard there's good skiing in Colorado, but that would be a nice excuse to come and visit a colleague from afar. I call you all my colleagues because I love to do things like this where I get to chat with like-minded professionals, where we get to connect on topics that are of interest and that are really important to me and to the people I connect with. And so this is what we're here to talk about today, is dynamic assessment. I chose this topic for Better Speech and Hearing Month this year because I feel like I myself, I'm not such a newbie, but I'm always developing more ways to delve into dynamic assessment. And I feel like it's something that we don't talk about enough, that people know of it, but don't necessarily know where to start. So this is what I want to talk about today. So to jumpstart, here in Canada for Better Speech and Hearing Month, the Canadian Association has like a tagline for this year, or a theme, and it's communication is. So I wanted to kind of start off with, what is communication for you? As you know, we're wrapping up this Better Speech and Hearing Month. What would you say communication is to you?
Oh my gosh, that's such a philosophical question.
Isn't it?
I think communication is actually pretty miraculous. The way that we are able to tell our stories and tell our inside stories, put them outside, even just like connect with each other without talking. So communication to me is definitely not talking. Communication is so much more.
Right.
But yeah, communication is like a miraculous part of life to me.
Isn't it wonderful how much we can do? Often I feel like people will think about communication as words, language, but it goes way beyond that and spans also from culture to culture, and from place to place, even from language to language. The way we communicate, whether it's orally or non-orally, will vary greatly based on our culture and our identity and, you know, our peer group and the way we were brought up and all of that stuff. So it's so intricate and beautiful, communication. And it is a right for everyone to have access to communication. So, you know, that's what we want to do for the families that we work with. So delving right into that, you know, thinking about dynamic assessment in order to give access to certain kids, access to services if they do need it or don't need it. Like, what is your experience with dynamic assessment? What would you say is dynamic assessment? I know you were giving a training with some peers on this last year. So talk to us a little bit about, what's dynamic assessment? What is it to you? Because I think there are some formal definitions, but you may have your own as well.
I have, if you go to my Instagram, I have a little funny little reel about it. And people, like you said, they think about dynamic assessment as this scary, mystical thing that nobody knows how to do. And I kind of made a joke on it back in 2021 when we were all online. Like, dynamic assessment is just not static. So that's all it is. It's just an approach. It's a process. And the big difference between dynamic assessment and a static assessment, which is what we're used to we're trained on using is that we're not looking at performance. We're not looking, we all get that talk in assessment class of like, oh, you're looking at a snapshot in time.
Yeah, exactly.
How this kid performs on this snapshot. Dynamic assessment gives you, quote, Dr. Perry. She's one of our guests on the podcast too. She said, you want that HD, amazing 3D view of the kid. You use
I like that.
assessment.
I like that. Dr. Perry.
Like the snapshot. Yeah, Dr. Valencia Perry. She was one of our guests in one of our seasons. And I guess I didn't say any of that in my intro. I host a podcast with two friends. One of them is Canadian, is also friends with Melissa, Lisa Silveraja, and Desi Pena. And we host the Bold SLP podcast. And then we teach this class. And my portion in the class is about dynamic assessment. But I do want to backtrack a little bit on why dynamic assessment is so important to me.
Yeah.
All the way back to grad school, coming in as being bilingual myself, just being raised in two cultures, two languages, two countries, part of my life. I know that maybe in Montreal is very typical.
Yes.
To have multilingual children and multilingual education. But in the US, in the 90s, it wasn't such a thing. So a lot of my bilingualism comes from my family wanting to hold on to my Spanish at home, also in Mexico, where English is very much valued for professional reasons.
Absolutely.
So everybody who's like, oh, you know English because, I'm like, I know English because of my parents and because Mexican schools. But my first assessment class, you are given a task, and I had to pick a test and give it to a student, find someone.
Yeah.
And I found my neighbor, and she was a bilingual child, just like I was, 6-year-old little girl. And I did my report and everything, and you have to go through the whole test, psychometrics and all the statistics and how everything works. And I had a horrible experience with that professor because she didn't understand how I was approaching it differently when I realized that the norms for that test didn't apply to the child that I had access to. And so very, very early on, I was like, wait, I came into this field because someone told me, hey, you're bilingual, you'll always have a job, you're so needed.
Yeah.
Spanish speaking population is growing in the US, you're going to be in high demand. Yeah. And my teachers won't teach me how to do my job because they're only teaching us how to deal with standard norm monolingual English speakers. So very early on, I realized I'm going to have to do my own thing. I'm going to have to figure this out. And so I did. Whenever I started working, I had a closet full of assessments like we all do, and we're very fortunate to have, and they're expensive tools and they have their place. 90% of them didn't help me do my job, which was differentiate between the language difference and the language disorder. And out, is this bilingual student really having a language disability or not? And I had to do my own research.
Yeah. So how did you get to dynamic assessments? Like at what point in you saw this early on? It's funny because I'm in a predominantly Francophone community. I mean, in Quebec, the majority language is French. At the political level, it's very, there's a big concern about keeping the French language and preserving it. But in the same time, it's creating attitudes that are devaluing other languages because people are so afraid of losing the French language, instead of seeing that if we value everyone's individuality and culture, that people will be happy to learn the language and be part of the community. So anyways, I won't get too much into the political aspect about it.
No, we've had conversations with Lisa about the irony.
It is quite ironic, but I did my master's degree in English. So I learned all my stuff in English. I did my younger schooling in French and then my higher education in English. And it was a choice because I had access to it. And then I got out of school and people were like, oh my God, you're bilingual. You speak French and English. You'll be really wanted, because there are not many Anglophone SLPs. But when you think about it, in Canada, French and English are majority languages, like throughout Canada. Quebec, it will be more French, but then as soon as you leave and you go to Ontario, for example, it's more Anglophone. So anyways, I learned all my stuff in English, and I found myself actually working with 90% Francophone community. So I had to like switch my brain to French. And I was seeing a lot of monolingual French kids for a long, long time. But in my studies, we learned everything in English. And there was an optional course if we wanted to learn about some French norms or French tests or some practices for working in French. But never I didn't have that realization until much later on in my career. And when I became a mom, that these are not separate entities, even though I myself have always, I'm actually trilingual. I grew up in a French, English, Arabic home. My parents are first generation from Egypt. And so I was trilingual before I entered school. I knew all three languages. And anyways, I found myself isolating the two for a long time because I was following, right, this like, okay, I have to do like I was taught. But then quickly I was meeting children from diverse backgrounds. And at some point I was like, well, this is not working. So my assessments weren't really matching my interventions after, to be honest. I was doing what I was supposed to do in my assessment, but it wasn't really giving me what I needed. Yeah. So how did you make your way to dynamic assessment as well?
Well, I had a really good mentor. I had a supervisor who was monolingual English speaker. And she was so amazing. She is so amazing. I'm still in touch with her. But she made sure I had access to a bilingual SLP to mentor me as well. I got lucky to land somewhere where there was someone. I'm learning as I get to know more of my coworkers and colleagues that that's not the case. But I just delved into the work people were doing in Texas, because that's where I went to grad school.
Right.
Brasendis, and then in California, Dr. Liz Pena. Dynamic assessment is not new. And I think it also helped. I always bring this caveat because SLPs tend to like feel some sense of like, I'm not good enough because I didn't know this early enough. And I'm always like, get that off your plate. Like, you know it now, and that's perfect.
Right. Better do better. Once you know,
once you know,
start bringing changes to your practice, right? And it doesn't happen overnight.
No, it's a practice for a reason. And that's another one of our guests, Dr. Maria Resendez. She's like, if ever you stop practicing and changing and like you're done, what are you doing? As a therapist, as a pathologist, like you're always looking to improve. But my background in psychology, that's what my undergraduate or my university was on, I think really helped me, because dynamic assessment comes from that field. It comes from the field of psychology. And so I was not completely new to it, but it was a new lens into which to look at language performance and language learning.
So did you connect those dots yourself? Were you like, well, we kind of saw stuff like this in my undergrad?
No, there's so much research out there, Melissa. Back to the 2000s from Dr. Liz Pena. She has great modules on ASHA. I tell everybody that I can about it. She has free video, PDFs, all about dynamic assessment and the work that they've been doing.
That's tremendous amount of work there. Yeah.
Yeah. And then just reading what people are doing, but understanding just the basics of Vygotsky's zone of proximal development.
Yeah.
I was like, okay, we do this all the time.
Yeah.
We do this all the time.
An intervention.
When we do intervention, when we develop a plan, we do this all the time as SLPs. We figure out where this child is at and what we need to do to get them to the next level of achieving that skill.
Right.
What supports they need, what scaffolding they need. We do this every day. We're trained to do this every day. And so just had to like put that lens onto the assessment piece of my work.
Yeah. So for someone who's like starting out, when you say, oh, they don't want to, maybe we have reticence, I think, to change our way of doing because, well, there's a level of comfort there. And I think that static assessments are easy in the sense that once you're familiarized with the test, you're kind of on autopilot in a way. You shouldn't be on autopilot, but.
No, I know items from the owls by heart.
By heart.
I just see the 4 pictures and I know exactly what the prompt is going to be.
Not on that test, but on others. So for someone who's starting out for doing dynamic assessment, would you have a tip?
Yeah.
Where could someone start if they wanted to just start with a really small, like something that they could easily implement?
I would say start with a test that you're already comfortable with. And I always say the owls because that's the one that brought people to my page. This is something that I've been doing for a long time, and I didn't think it was anything special, but I was giving the owls, and the owls in itself has some layers of differentiation. So in proximal development kind of things where they're like, okay, this answer is acceptable. This answer is preferred. And then you go and see why, there's already nuance built into that test. And so I don't know. I did a little reel about it. I said, look, this kid answered this. And then after we were done, I went back to it and I probed. I was like, okay, why did you answer this? And I just kind of went through the steps of like, just dig a little deeper. You already did your test. You got your scores. Maybe this student is a borderline student. They're like in an 79, 81 standard score range, and you need more information. Go and see which items they were kind of close on, or, just note it as you go along and see, hey, if I give you the chance to talk about it, do you change your answer? Right. If I give you a repetition, do you click with it a little bit better? If I give you the definition
where you're not supposed to give a repetition, for example.
Right.
Sorry, I'm trying to be specific because I know people have a hard time. They want to see, we like to see, what does it actually look like in practice. So
I may link it to you so you can share it later.
Yeah, I want to backtrack 1 second because I'm not familiar with the owls. Can you tell us what test it is and what?
It's the Oral Written Language Scales on its 2nd edition. I would say it's similar to the SELF on some parts, if you're familiar with the SELF, but it has a listening comprehension and oral expression portion.
Right.
That you can really just be your starting off point where you're not sure where this client is going in terms of skills.
Yeah.
But you can do it on the PLS. They have all kinds of prompts that are already built in there. And another way to think about it too, that I tell people is when you give an articulation test, the kid can't say their K. Mm-hmm. They said tat instead of cat. You don't just leave it at that and give them a 0. Right. Normally you go back and you probe. You go back and you see, can they say the K if I show them to them? Can they say the K if I give a picture of what their mouth is supposed to be doing? Can they say the K if we do a tactile prompt? You go back and probe and see what you're going to be starting off with once you do therapy.
Absolutely.
And that's all that dynamic assessment is that test, teach, and then test it again to see what's working.
Right.
And there's, of course, very stringent protocols of doing it that can take a long time. And I feel generally that's it. Using your critical thinking, your clinical experience, because what typical language looks like by now, hopefully. And if you don't, ask people, go and gather that information. But that's all it is to me. Long answer.
No, that's a great answer. And I want to get a little bit deeper into some of these things that you said. I think that it's exactly what you described, right? We would pass tests, at least me and I also graduated in 2011. So when I started, I would just, pass the test. It's you scored or you didn't score, you got it or you didn't get it, because we weren't allowed to repeat some of the sentences or give any feedback. And you just have to be
follow the protocol.
Great. All right. Let's keep going. And I would, remind myself, stay super neutral. And slowly along the years, I realized I just started asking more questions or prompting on the spot. So I guess you could pass the whole subtest and then go back on where there were errors and do a little bit of teaching there, right? Like you said, and note down the kind of teaching that you're doing. Are you repeating? Are you simplifying? Are you using gestures?
And Dr. Pena has that all laid out for us on those modules. If you want to research it more, the buzzword is mediated learning.
Yeah.
So mediated learning experiences. There's whole protocols on that.
Yeah. Well, there are the 2 styles of dynamic assessment, right? There's the test, teach, retest, or there's the mediated learning. But I feel like they kind of go hand in hand. You could, but for younger kids, I wouldn't necessarily do the mediated learning because they may not be able to go through all the steps with me where they would understand where there's the transcendence, where you explain what the task is and tell them what's the goal. why do we need this skill, this particular skill in life? And how is it going to benefit if you're not able to follow an instruction, for example, that has 3 steps? So for younger children, it might look a little bit different because you work with school age kids, right?
Yeah. I think definitely like 3rd grade and up, they benefit from that mediated learning experience. I know we've been focusing on bilingualism, and that's like a big focus of mine as well. But with our neurodivergent populations, they thrive when you give them that mediated learning experience. And they're like, that's why you're asking me to do this.
Right.
And
those metacognitive skills, right?
Yeah, a lot of them have strong cognitive and language skills, but say their attention skills are not so great.
Right.
And you give them the recalling sentences portion of the self, and they're 10 years old and they have ADHD. Well, they may not be able to repeat because they weren't attending in the first place. And you can't repeat and you can't prompt. It's so frustrating.
So what would you do? So for example, you gave a really nice specific example, the sentence repetition. What are you doing in a sentence repetition task when your kid is pretty much bombing all of them and they're not getting anything because maybe attention is fragile, which we have a lot of these kids that have these concomitant neurological disorders. There might often be ADD or ADHD associated with a learning disability. Yeah. So what would you do in that task in that moment?
So I follow the protocol and they zero out. And then I go to the end where the longest sentences are.
Yeah.
And I'm like, okay, let's try it with repetition. Ask me if you need to hear it again, and I'll say it again. And some of them might be fine with that. And if they're not, I'm like, okay, I'm going to give you a reminder before a long one comes on. Be ready. Because we all know accommodations wise, like getting their attention before you give them a message is like half the battle. So I'm like, okay, ready? This one's really long. And then if they're able to do it, I'm like, okay, they just need that extra like warning sign to their brain, like I need to attend to this message. Or I go to visuals and I'm able to give that information. I'm like, okay, something's going on. They're not able to recall without the visual. And then you dig deeper. You give another, assessment or another measure to see what's going on. Is it auditory processing? Is it just memory? Work with the psychologist. How did they do on your working memory test? And you just are a clinician.
Exactly. Then we can maybe even complement with a non-word repetition task to see if we remove that aspect, the language aspect, and this is what I want to circle back to. You said, we're clinicians and we know what typical development is, but I think another big part of all of this is, at least for my monolingual peers who are only French speaking and they have these multilingual kids coming, they're like, well, what is typical development? Because this child has language 1 and language 2 as their home language, and maybe French is language number 3. So what am I expecting? So when we are doing sentence repetition tasks, for example, that's very language based. And so they may not be able to repeat because for so many different reasons, grammatical reasons, syntactic reasons, lexical reasons.
I'll steal an example that I love about that. They're like, imagine they give you 5 sentences from Shakespeare, Romeo and Juliet. See how well you do repeating Old English.
Oh, I love that. That's a great example.
Yeah, I stole that from a coworker. I'm like, oh my gosh, you're so right. Like, it's not my dialect. It's not the grammar that I'm used to. The vocabulary is definitely not something I'm used to. And then contextually is not like my reality.
Yeah.
So having to repeat sentences from Shakespeare play is going to have me looking like I have a language disorder.
Right. I love that example. It's really nice to have these kind of parallels that we can make so we're able to best put ourselves in the kids' shoes. So what does help inform you if a child has less experience with the majority language? What does help inform you to make that decision in between a difference and a disorder? Like, do you do dynamic assessment in the first year that they're bathing in that? Okay, let's say English is the majority language. So if it's their first or second year that they're learning English, would you do a dynamic assessment in those first couple of years? Would you wait? So
it depends. I always, so part of our course is that this is Desi's portion of the course, talking about how we view data and the weight we give to the data. And I'm doing this But in ASHA, they teach us the triangle, right? The evidence is down here. The base of the pyramid is those tests, that external and internal data evidence. And then over here on the side is your clinical judgment. And then on this side is the client values or client perspectives, or in our children's cases, like teachers and parents' perspectives.
Oh, yeah.
So we're kind of taught to do this hierarchy thing. And as a group, we've moved more towards a whole circle kind of a thing.
Yes.
Like, if I don't have a lot of the data right now because this child maybe just entered kindergarten, I look at what's going on case history wise, like parent concerns, teachers that they've had in preschool. Are they seeing something that's concerning them? Parents have other children and they're like, this one's not learning like my other children learn, and I haven't changed anything. And then you have, your clinical judgment too, where you can gather information about their language history and kind of rule out some things, or even health history. But yeah, I would do a screening for sure, and the language that they're stronger in.
Right.
And I'm very fortunate here. Like, if I get a kindergartner like that, I would already have data from our multicultural office because they screen all of them.
Oh, that's really good. See, we definitely don't have that. But sometimes the parents already have concern, but there's no screener coming with, especially for the younger children. And we have a lot of immigrants coming in. We have refugees coming in. And they've come quickly for whatever reason, they're leaving for, and then there's all those factors to take into consideration in this triangle, right? Is there like are there psychosocial challenges that they're living through that we should consider? Are these things that you write in your report? I always sometimes I want to tread lightly because I don't want it to create a bias or write something that could be discriminatory against a child if I'm describing a little bit too lengthily their situation. This is really interesting. I just, this question's popping up in my head. I'm always asking myself, is this pertinent? Should I be writing this? And then am I writing this also back in my conclusion to be able to support or refute or say, okay, you know what, we're going to wait a little bit longer because there's other stuff going on. So how do you deal with that kind of information?
As a school, we deal with it together. So I don't write a report on my own. We write a full eval altogether. It's usually 3 or 4 providers.
So who are these providers?
School psych or diagnostician, occupational therapy, physical therapy, me, and then the diagnostician goes through educational, like teacher surveys, behavior surveys, observations. So the schools are very different from clinical setting, but there's actually exclusionary factors in our laws here in the US. Like you were saying, like psychosocial, even absenteeism, and any other thing that would rule out that the student has had enough instruction.
Right.
So you have to look at all of it.
And how do you use these exclusionary factors? This is really interesting because it's very different here. So I'll tell you a little bit.
Yeah, no, they wouldn't be labeled with a disability if we have any question about those other factors impacting performance.
Right.
We'd have to say, no, they don't have a disability.
You would say no, or would you I don't like using the words wait and see because we used this many years ago for other reasons. And we know that we don't wait and see, but might you say mitigated? I'm not sure. I see some difficulties. We've done some dynamic assessment. This child's needed a lot of scaffolding, but there are all these factors that can be impacting this. Maybe would you do like a response to intervention for this child, or like, what are you doing? You're not just off, right? They've come because there's something going on. Yeah.
So in the schools, you would say they don't qualify for special education, but this is how we can support them. And there's response to intervention teams, there's language assistance teams. Now they're moving toward multi-tiered systems of support. There's all kinds of other interventions that are not special education.
I love how it's structured. That's really good.
They try. It's not perfect by any means. But I'm thinking in a clinical setting, it might be very different, and you could weigh more heavily how this perceived delay or disorder or whatever skill that's in deficit is impacting their access to their community. So
Right.
you have a little bit more leeway, I would say, in the clinical setting, which I'm kind of diving into this
Yes.
summer and this year. So it'll be new to me. I might have a totally different perspective if we do this again next year.
Yeah, so this was my next question. You mentioned that you're leaving the school system. This is
Yeah.
stepping out of your comfort zone. So you were already doing a little bit of private practice, is that right?
Yeah, but I was contracting still with
Okay.
a school. So I was still doing
You were
school
still in the
things.
schools. So you still had access to all these other professionals where you were working as a team for these children. We don't have all that support. I mean, I'll tell you a little bit about how it is
Yeah.
after. How do you see yourself being able to wear all these hats now? Like in private practice, are you going to be just you yourself? Because I wear all the hats. I have my private practice. I go into daycare. I work mostly with 0 to 6, 7, say. So I wear all the hats. I'm the first line. Families are coming directly to see me if they can afford it. If not, I have daycares that I go to in certain areas that have lots of needs, and they get access to subsidies. So I'm able to provide supports for the children who truly have a disorder or difficulties are impacting significantly their ability to integrate into the daycare, into their classroom with their same age peers. So how do you see yourself doing this on your own?
I don't know what it looks like. I'm not on my own.
Okay.
I'm working with, like I said, my mentor. So we're kind of the one from way back then, my first year, my clinical
That's
fellowship
amazing.
year. Um, so I won't be completely all alone, but yeah, it's going to be a whole new adventure.
That's exciting though.
I am excited. I'm excited because, like I said, the schools have the systems, but they don't run perfectly and they can be frustrating, especially when it's like a truly like clinical case, like a voice case,
Mm-hmm.
where it's like the academic impact is there in terms of like socially or, to some access here and there, but it's a voice case, I
Right.
have all of these hoops to jump through to fit it into the educational model. So it's just a different model that I'll have to get used to, and the insurance game and the private pay game.
Yeah, that's a whole other
Yeah.
aspect to that. You guys have that here. So here we have, because we have free healthcare. So some families with their jobs do have access to healthcare. So their jobs may offer them packages. So they can then, some will go and get private services, and they can then they submit themselves to their insurance and get refunded.
Okay.
In certain cases, so they can check in advance. But in the school setting, we have SLPs that are working in schools. Many schools don't have SLPs. We have, I don't know what's the English word equivalent for this, but we call an orthopedagogue, which is a person who will work with children who have potential learning disabilities or difficulties. And they'll typically, like, actually, little private tidbit, my daughter is having some struggles at school. Ironically enough, I'm going to have a colleague of mine diagnose her because it's easier that way. I'm definitely not going to be doing that. My mom it's so far down on my head. But anyways, so she's had access to this person who she's in second grade. So she's 8 years old. So since first grade, we saw that there were difficulties paying attention, having difficulty learning how to read at the same speed as others, difficulties
Mhm.
writing. And so this person will intervene in a preventative manner. I feel like it's a little bit late. It should be probably kindergarten where they do screeners and do RTI, but they're not doing that. So this person will work on more global reading and writing. They won't touch math, because even though math will fall on, mathematics will fall
That's my
under.
new soapbox for another day, how much
Yeah.
language impacts math, but
Yes.
maybe
Yes.
another live.
Yes, that would be, I'm gonna actually write it down, because I'm not ready to have a full-blown podcast yet. It's very time consuming. I know you girls have your podcast, and I can't wait. Hopefully, are there any more episodes coming anytime soon?
I'll give you the exclusive. We're recording next week. So
Okay, I'm excited. So we'll let you guys know at the end for the people who are listening, or will listen later on. We'll give all the handles at the end. But yeah, maybe I'll do like periodical months like this, where I had a lot of guests this month, but really I would like to have maybe I could start slowly. Maybe I would do 2 guests per month. You guys batch do it? Anyways, I should speak about this with you privately.
We'll talk
How do
later.
you organize all your stuff? But math is a very interesting topic because I feel like we weren't trained in all of dyscalculia and all this stuff in school at all. And I'm just now taking like mini trainings on this because I'm like, I've been missing stuff with these kids. Like I'm not even touching that at all. And I need to delve more into that, but I veered totally off topic. Coming back, we have SLPs in schools. We have the orthopedagogue, which is kind of like a special ed teacher, but
yeah, I was going to say, it sounds like our resource teachers here.
Yeah, we do have, there are also resource teachers in the English schools, but they're not orthopedagogue. They don't have that training. So the orthopedagogue could take for example, if we did an assessment and intervention plan, they could take our intervention plan, and then in the individualized education plan that they'll put together at school, they can then have a more specific goal for the child. So for now, for example, for my daughter, they put more general goals for reading and writing, but when I'll have her report this summer, then the SLP will have more specific, working on these sounds, or, because we put a goal for reading speed. Obviously, we want her reading speed to increase, but how are we going to get there? They're more general IEP goals. And then, so this person will work on those IEP goals, but we don't, and sometimes we have psychologists in the schools, but what you're describing, having an OT and like a resource teacher, and you have your psychologist or neuropsychologist, and you have access to all these people, I'm like, wow.
Yeah, and not at every school at the district level, but we do have an SLP at every school.
Wow.
And then we share the diagnostician, psychologist, OT, and PT with the other schools in the district. But yeah, we have access to all of them.
That's really, really something fantastic. The SLPs here working in the public sector. So let's say whatever's associated to the medical system. So there are like outpatient clinics that are publicly funded. They'll have maybe more access to, I would say, a more healthcare team, such as the one you're describing. In the schools, there'll be like one psychologist for the whole school district. So like I got a phone call for 5 minutes from a psychologist who didn't assess my daughter. I had to go and do it privately. Anyways, so it's really great that you have access to all these resources. So getting back to dynamic assessment, why do you think that standardized testing, how you were describing your bad experience in school, why do you think that this has been taught as the gold standard of assessment? And yeah.
I don't know. I think it's kind of human nature to want to fit everybody in a box.
Yeah.
But just in listening to people who are researching it now and trying to do it differently, even the way they standardize these tests makes no sense.
Right.
And that's probably what I was coming up against in my class in grad school, because I was in psychology, I was doing statistics, I was designing experiments, like I know what that looks like. I know what, validity and reliability are all about. Like it wasn't like my first rodeo, and I'm like, these numbers don't make any sense.
Yeah.
I don't know if, so a way that I've heard it explained on SLP Nerdcast is another lovely podcast that all SLPs should go check out. It's almost like they do this sampling of the population to make these tests, right?
Yes.
And they regress it all to the mean, and then we all compare it to that mean.
Right.
Well, and we all assume, okay, this is average. It's awesome. You sampled everybody and it's an average. But in reality, you're comparing every kid you see to one imaginary kid that is 16% Hispanic, 12% African American. There's no
very specific profile.
Yes. So like nobody fits it. Like not even our monolingual students fit it. So everybody who I bring this up to, and they're like, well, it's because you're Mexican. Oh, it's because you're bilingual. And I'm like, no, it's because I understand how data works, and the way we're doing these assessments helps no one.
You're right.
And the way we're using them. So I always try to be very clear. Like if you use the tool correctly, if you give the self just to see what's happening and not use it as your only tool to diagnose without looking at case history or the psychologist results or teacher data, that's a problem. That's the problem. The test is just a tool,
Yeah.
It's important to have it in your toolbox.
Absolutely.
it's important to understand its limitations.
Yes. So it's not something you would gloss over, like you wouldn't skip over the static tests. You would still recommend your peers to keep using those static tests and then use clinical judgment.
Familiar with it, yeah.
Get familiar with it, use your clinical judgment, gather other information, right? So I think
yes,
that's for me, the biggest thing that's changed is how much more time I take with families to create the connection with them and gather so much precious information that's going to help inform not only my assessment, but my intervention. Because it's easy to assume or to imagine what their day-to-day looks like. But unless you ask them and show that, you know, cultural humility and ask open-ended questions so they can tell you where they're coming from and is this typical in their home and what is communication to them? And, you know, do they even know what speech therapy is? Have they had experience with speech pathologists?
Yeah, you might start down there.
Yeah. And then some families have completely different, you know, perspectives on play and interaction. So all of these things play into it. And this is tying right back into these standardized tests, right? Is even the way we test questioning children. This is not typical in many parts of the world where we're in an individualistic society, right?
Yeah, it's all very interesting how we landed here. But I think the main takeaway I think I want to give, if clinicians are listening, that dynamic assessment is very well worth your while in terms of like spending time learning it and figuring out how you can implement it, because it'll be better serving your clients, of course, but also it'll just make your report writing a breeze, your goal writing a breeze. Like when you actually have meat in those numbers beyond the zeros and ones and the percentile ranks, when you're like, oh, this kid needs repetitions, or this client does better with illustrations, or this client does better whenever I provide a reminder before we start. You have already built in like what kinds of goals you want to work on, what kind of recommendations you want to give, and what kind of strengths you want to share with these families who are hearing, hey, look at all these zeros and ones and look at what your kid can't do.
Exactly. I know, I hate it too. And it's really shifting us from a deficit point of view to what can your child do? Because parents they know that there's something, if they're the ones who are coming to you, they know that there's something off. And that's one thing I always tell, you know, other clinicians is the parent's instinct is always to be trusted. You have to trust parents and become a team with them, because you can't do what you need to do without getting their information and trusting that what they're telling you instinctually is the correct information. Obviously, like you said, we have to complete. We don't just take this piece, right? It's a puzzle and we got to put it all together.
Yeah, it's a whole thing.
Yeah, at the circle. I liked how you said that. So where that you said that's Desi, that was in your course that you're teaching, that was Desi's portion where she kind of alludes to this circle. It's not
and then what we're just talking about now is Lisa's portion. She does the ethnographic interviewing.
Yes.
So anytime anybody asks me, like, what's your intake form look like? And I'm like, well, ever since I met Lisa, it's a blank piece of paper.
Right.
Just leave it all, the judgment out the door. And my favorite example of that is when you go to the doctor and you have these forms and they're already putting ideas in your head of what the right answer should be, right? Because they're like, how many hours a week do you exercise? And you're already like, gosh, it's got to be a couple hours. You know, I can't say the truth that it's 0 or 30 minutes, because they already have
the way it's formulated
in the question what the expectation is. And you're more likely to not be honest when there's already a little bit of judgment. We do it all the time to parents when we're like, how many hours a day do you talk to your child? What kind of games do you play with your child? We're assuming a lot right there. And I love Desi's story. She talks about being interviewed by a researcher and she's like, how often do you talk to your child in the car? And she's like, in the car, I'm exhausted. He's asleep. It's quiet. Like I put on my, favorite audiobook or whatever and just drive. Like, what do you mean?
Yeah.
Like the implied judgment in these questions, it just doesn't get us anywhere.
Yeah. And those are like leading questions where, and that's one thing that I included because I also provide a training on, assessment and intervention with multilingual, multicultural children. And I read a book from Linda K. Murphy called The Declarative Language Handbook. And it's a book that she developed working with neurodivergent children on how to help children develop joint attention, children who are neurodivergent, by modifying the way we talk and going away from an imperative language style to a declarative language style. I found that I do a lot of this when I'm working with families, where instead of saying like, do you read books at night? I would say like, what does your nighttime routine look like? Like, when is the time that you guys enjoy spending the most time together? Do you have time to spend together where it's uninterrupted? Sometimes there are many siblings and parents will tell me like, it's really hectic. We don't have one-on-one time. So I keep the questions more open-ended.
Right.
And I'll use this declarative language where I'm using more cognitive skills. Like, I hear that you're saying, and I think, and I observed, and using this more like neutral language that leaves it open, and that's not leading to you should be doing this or I'm expecting that. Because there are all these cultural differences then that come into play, and that can create barriers between us and the parents if they hear something that we say that doesn't align with them. So also like tuning into the parent, right? And being like, what do you think about this? And does this resonate with you? Or like, is this something that you've heard of or know of, or something that you commonly do? Do you like to chat with your child? I've had a lot of actually Hispanic families I work with that will tell me like, we're really loud. We talk. I had one mom, I love her so much. She would talk so much and so fast. And she told me, she said, Melissa, I can't. I'm just like a motor mouth. I talk so much. And we worked a lot on, maybe having her leave a little bit more space for her son, who was really young at the time. And I did like parent partnership with her, where we did like home videos, and she would watch the videos and be like, wow, I thought I was doing really well, but I haven't stopped talking. And I probably asked him 15 questions without giving him a chance to answer. Or like another Hispanic family that I work with, and the mom said, yeah, it's really loud in my house. We often have like the radio and music and TV, and the kids are playing, and it's like, Dad, we're just singing. And so these are things that we want to not assume that it's like everyone's sitting, for example, at the dinner table together. These are all. So yeah, having that cultural humility and humbleness to ask the open-ended questions without assuming.
Yeah.
Okay, we only have a few minutes left. I want to ask you a quick question. I had two questions. I didn't get at all to talk about interpreters. I feel like maybe I should do a whole other like mini series maybe on working with interpreters, but
I'll just give you my quick answer. I haven't, so I don't know.
You haven't? How come? So do all the kids you work with, are they all, if they are bilingual, is it always Spanish and English, or have you worked with other
33% Spanish? Yeah.
And have you worked with children from other backgrounds?
I have, but they all speak English as well.
Okay. And have you ever thought, this child is significantly exposed to their L1 and I don't speak that language, and like, what do you do?
So in the more common is another language that's also in culture and language, depends on their generational path. But there's also Native American tribes nearby. 33% of my students are from some nearby Native American tribes, mostly Navajo or Diné. And I actually have access to the Navajo teacher who knows these students from kindergarten on. And I collaborate with her a lot. But fantastic. I have collaborated with her in the past a lot. And then generally I have had students who come from other countries and other continents, but by the time they come to me, they are speaking English. And I actually see more with that population, a lot of language loss, a lot of language attrition of their home language. Yeah. Because there's no one around them other than their parents at home that speak it. And when they move here, they like grab onto that English in whichever way they can. Right. And so I've
For
had to do a lot
survival,
of,
right?
yeah, to survive.
They have no
That's
choice.
one
They
of my
have to
most
learn.
liked posts. I was like, I didn't learn Spanish as a resume booster, y'all. Like I learned Spanish because I learned English because I had to survive. Like,
Yeah.
period. You know, when I moved to the US, I was 6 years old. I got dropped into a English speaking classroom and I didn't even know what Monday was. Like I remember going home and telling my mom, like, they just keep saying Monday, 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 which is a word in Spanish that we use to kind of say what in a more nice way than just saying what. And I'm like, why do they keep saying Monday? Like I didn't know. I had little neighbors who would offer me Capri Suns, and I'm like, Mom, the neighbors are trying to offer me burritos because they look like foil, you know? Like I didn't know. So yeah, I tell people all the time, like I'm bilingual because I had to survive. And when I advocate for these students, when I test these students, when I work with these families, I come from a place of experience. Like I have been there. I was them when I was little. So yeah, I tend to really closely work with the families whenever I don't have access to those interpreters. I mean, it's some of them are African dialects that
Same. I've
yeah,
had so many. I actually have one upcoming where the language is Kirundi, and I went on a deep dive looking for resources, but I'm just going to do the best that I can with the family. The child is also exposed to French and English, is
same.
neurodivergent, and so there's like it's like a big case, but again,
That's my case study in the course.
is it?
That's yeah, like that. Neurodivergent, African language, French and English.
I love it.
Yeah, that's the case study. But yeah, you just have to get really comfortable asking questions and digging. I did a phonological, oh my gosh, what is the word? Contrastive analysis between
Yes.
the sounds in English and the sounds in their African language. And even then, because they were like, oh, he has this accented English. And I'm
Yeah.
like, which is totally typical for a speaker of his African language. So
Yes.
next problem, please. Because
We don't want to take away that accent because that's part of his
no,
identity and his culture.
yes.
Yeah, I know. I get a lot of those like, oh, there's an accent here in Quebec, like the French speakers, we speak French in this very particular kind of way, not like
The
French in
French.
France. Some kids pick it up. Some kids from coming from other countries, they'll pick up this really heavy French Quebec accent, and SLPs will be like, yeah, but what do I do? And I'm like, nothing.
What
They're
can you
picking it
do?
up from their peers. They're picking it up probably from their teachers. It's totally
Mhm.
normal. And it's not, and it's funny because you would think that their home language is influencing the way they're acquiring their French, but no, they're picking up those expressions too, and the way you say it and the
Cool.
way you put the stress on certain
I know. I
syllables.
never realized, like, I thought, like, mine's pretty neutral. But Jessie is from New Jersey and also Florida. And she's like, no, you sound pretty Californian. I'm like, what? I had no idea I sounded like anything other than me. But she's like, yeah,
I know.
you can tell. Like, you have your little, like, California Chicana way. I'm like, okay.
Really, I don't know. You sound I would say you have like an American English. But again, like what does that actually
What does
mean?
that mean?
I,
Yeah.
from my peers or like colleagues in Quebec, sometimes people will tell me, oh, wow, you're perfectly bilingual. Or I'll get, oh, you have a bit of an English accent when I speak French. And then I go to Ontario, I have a lot of family and it's very English there. My family really doesn't speak French, it's only English.
Mhm.
And my cousins will tell me I have a French accent when I'm speaking English.
Yeah.
So it's like,
Everybody's
everybody
perception.
has a different perception wherever I go. It's always different.
Yeah.
I guess the Arabic didn't really, I even picked up a little bit of my husband's Italian accent, I guess, on some words, the way I punctuate, or stress the word.
It's
But
so funny.
anyways, okay. I mean, we're wrapping up. I want to speak to you about so many other things. I wanted to speak to you about AI. Like just quickly, you talked
Oh,
about
yeah.
doing a contrastive phonological analysis. Have you used AI yet? Have you dove into using it as your personal assistant, boosting your work and, reducing your research time and by
I
using these types?
haven't I haven't done it, but I went to a really awesome presentation at ASHA last fall in Boston. Barbara Fernandez, she presented on it and how she uses it. And so I kind of dipped my toes in it a little bit for language sampling.
Yeah.
I was
Yes.
like, wow, like it really counts every little, grammatical structure and all of that. But I hadn't thought about it for contrastive analysis of different sounds because you could even do it for dialects too.
Yeah.
I went to a really cool presentation about that.
Like writing down all these people I'm
That
able to.
was Aaron Bird. It was about African American English and mainstream American English and how you can really see the patterns and differentiate between an influence of a different language versus a different dialect versus just typical or versus a disorder, you know.
Right. I
And I
love
was
that.
so helpful because we deal with that all the time. Spanish influenced English all
Mm-hmm.
the time, you know,
Yeah.
especially here in New Mexico, where so many people are bilingual for so many generations. We have a lot of Spanish influenced English here.
That's beautiful. And so I think AI could be a really good tool to help us like just even access information more readily. You know, you can ask there's an AI tool that's developed here called Natalie AI, and it's only for SLPs.
Oh,
So they've
wow.
been programming this app or this AI platform for SLPs for like writing soap notes where you just record your session audio and you plug it into Natalie. She transcribes it into a big blob, a big text blob, and then you ask Natalie to write your soap note that's compliant with
That's
your
wild.
professional order. And it's yeah, so and it writes a compliant note. Obviously you have to use it with precaution and you have to like read it over and make sure that everything is good. But I've also been using to generate word lists, write emails in other languages to families that, yeah, maybe they speak French or English, but they're better in their home language. So I can write my email in my language and I ask my AI to translate it into the target language and I can send this stuff off to parents. I've
Right.
asked AI to give me information about certain languages. So I'm about to dive into my prep for my assessments next week where I have multilingual kids and I'm going to be asking AI to give me information on, what to expect for a child who's exposed to these an African language and French and English and is neurodivergent. So we'll see what turns up, but I think it's at the forefront now. I'm excited about introducing this new technology into our
Yeah.
practices and see where it can take us and how it can benefit and lessen our workload too.
It feels like now I'm old enough that I remember a wave of something else. I don't know if you remember the wave of the iPad.
Yes.
I mean, that was everybody was like, oh my gosh, letting go of their CD-ROMs and printing. And I was like, give me the iPad. I want to see what it's about. And I feel
Yeah.
the same way about AI. I know it has pitfalls and you have to be very careful, but I'm like, I want to know what it's about. I don't want to be surprised or left out or, you know, blinded to it just
Yeah.
because it can be scary. I feel the same way. I went to that course. One of the things that Barbara uses it for that I loved was teacher communications.
Yeah.
So we get a lot of information from teachers. They're like, well, they didn't pass this benchmark and they can't say their vocalic R whenever R controlled this. They have all their phonological, phonemic awareness things that they say. So Barbara will be like, okay, ChatGPT, make me an email for a teacher who has these concerns and these are the screening results. And then it makes it all nice and pretty, like with
Yeah.
teacher terms that is sometimes so hard for us because we speak a different language. We're looking at phonological awareness, but different little pieces of the sounds, and they're like, how does it affect their learning to read and write? They're like in different perspectives. So she showed us how to do that and even how to write an email to a parent about what they can do at home
Yeah.
if the student's working on their R or whatever it is. And I was like, wow, and she does it for so much more, like reports
Yeah. So much.
instead of like all the copy pasting that we do all the time.
Oh no. I mean, I use templates now, but also this Natalie AI is the next thing that's coming out in it is that parents will be able to subscribe while they're waiting for services if you've already done an assessment, and it will be able to generate activities for children while they're waiting for services, which
Yeah.
maybe that's not my favorite type of way to do things, but hey, why not give them access to something while they're waiting? And I think it's just the possibilities are endless of where we can go with this. We know that AI has been used a lot in like scientific research, like eye tracking studies. This has been like for a really long time. So it's just now coming to kind of a more mainstream usage. Everyone knows about GPT-4, but now people are developing these specific AIs for different settings, different professions. And anyways, I'll link it after. I have a lot of things to link. So I'm gonna as we wrap up, I'm going to be linking all the resources from Dr. Pena that you mentioned, and you mentioned SLP Nerdcast as well as your podcast, which I'm going to ask you to tell us about. And I'm going to go check out Barbara Fernandez and Aaron Bird if I can find their trainings on AI, because I think that we can all benefit from getting more efficient in our work and using these AI just as like virtual assistants to make things faster and more concise in terms of upkeep of your files and all the paperwork. Yeah, all the administrative stuff. And then start to discover what we can do even in our practice, how it can be complementary to what we're doing and speed things up. So can you tell us where we can find you? You very busy lady. Where can we find you? Where can we find your training?
Well, I'm probably going to be more active this summer on my private practice Instagram, my speech place. And I'm going to start a Facebook. I was going to for today, but I'm like, let's just give it a minute. And also very active on the Bold SLP Collective Instagram. We have a TikTok, but it's kind of just there. But I know a lot of people enjoy TikTok. But yeah, our course is actually listed through SLP Nerdcast. They have a web-based CEU platform. And so we partnered with them way back when. They invited us to be on their podcast, which you can earn CEUs from listening to their episodes. We did 2 episodes on dynamic assessment. And then they're like, we should do a course. And then we did the course. So it's starting in the summer, I think July.
So you're giving it again this summer, right? Because I know you gave it for the first time last summer.
Yes, last summer was the first time, and then we're doing it again this summer. Wonderful. It's all open there on SLP Nerdcast. Follow them, follow us, go to their website. Go to our website. We have some free resources on some of the things I talked about, like ethnographic interviewing and all these other things that can help you in your practice.
On the Bold SLP podcast website or on my speech place?
The Bold SLP podcast website. Beautiful. I think we have a free website, so just go to the Instagram and click the link to our website, because I don't think it's like theboldsLP.com or anything like that.
Okay.
We're just 3 friends. We're just 3 friends, 3 SLPs, 3 moms. Just
who got together and created
and we have like
I love that. Well, thank you so much for all the wonderful knowledge that you shared, for giving us, that little bit that we can start off with and feel comfortable with, like you said. And I just want to reiterate that one thing for me, that's my take home. When you said, for example, if you're passing a task with a child and the child, let's say, bottoms out after, 5 or 6 items, you can pass the other items as like a retest or as your teach, or you can teach with the items that they already got wrong in the ones that you've already administered, and then use the ones that you haven't administered as a retest. Because often we're like, I feel like we maybe overthink things. And so for me, I was like, that is a great tip and a great place to start. We're starting a little in a comfort zone, and then we're adding some of that niceness into it, and we're scaffolding and what we're doing.
That's kind of like dip your toe in the dynamic assessment water, and then leap into some leadersproject.org. I want to always shout them out. Like leap into some slam cards and go into the deep end with some non-word repetition tasks.
Oh yeah. And I really love the main also.
Yeah.
You use the main?
The main? Oh, I haven't heard of it.
The multilingual assessment for, I always forget what the I is, narratives. They're narratives. It's a dynamic assessment for narratives.
We'll have to look that up.
Okay, so I'll link that too under, I'm going to have a lot of work to do.
It sounds like the slam cards.
It's similar, except there's protocols in all different kinds of languages. It's been translated in many, many different languages. So I've used it in French. They do the slam
cards too. They have them in Spanish and Chinese, like all kinds.
Yeah, but so these are like sentence strips, and they're also available for BIPOC. There's different figures that appear on the different strips, so you can get like an African looking their material is diverse in their images and their content, which I really appreciate, because that's also another important aspect that we haven't gotten the chance to talk about, but is super important in being culturally responsive and having material that represents the kids and the families that we work with. Awesome. All right, so thank you so much.
Thank you.